Do you feel depressed every day? Are you having any times where you feel like you're not thinking as clearly as you could be? Well, we're here for you 24 hours a day, 7 days a week if you need anything else.
The Texas legislature 2 sessions ago created the opportunity for the expansion of mental health crisis services in the state.
The reason we decided to start crisis services in Tarrant County is that we saw a definite need to have an alternative to jail and hospital inpatient services. Individuals that go in crisis don't always need to go to those more intensive services, but we didn't have any kind of residential or respite care available to respond to their needs. And now with the community-based crisis services, we do have an alternative.
We then wrote a grant to say what our community needed, the community of Tarrant County, and came up with the crisis residential, crisis respite, and crisis stabilization programs. Also, our mobile crisis outreach team, and then enhancing our crisis line.
To my knowledge, this is the only place in the state of Texas that has as comprehensive a crisis continuum, and we've been able to do that as a result of a partnership with the county, the state, and the hospital district and other entities. It's a great program.
We have had a variety of stakeholders involved in the development of crisis services like county government, the hospital district, as well as other private hospitals here in their community. The sheriff's office and a variety of local police departments have been stakeholders to the process.
People are willing to take the time here to sit down, and our goal is always to solve problems.
We have been able to provide a piece that was missing in our community so that when people go into mental health crisis, they don't have to leave the community to go to the state hospital. So we've seen a great amount of progress in that area to keep people in the community, to give them the services that they need here.
I tried to commit suicide a year ago, and I took 100 milligram of amitriptyline, and I had 32 pills left, and I took all 32. I called my mother. I told my mom that I said, Mom, I just took all my pills and I'm leaving. And she said, all right, goodbye. And she hung up on me. And she called 911, and they kicked the door in right as I was going to sleep. So had she not hung up the phone and called, and she didn't know where I was, all she knew was a phone number. But they found me, and they brought me back to life. I've battled with depression for 15 years, and I'm such a better person now, mentally. I'm not in that state no more. They make you look at yourself and see what you've done and see how you can change that. And I think if you use those tools and can see, it just makes you better. It made me, the 4 days that I was there did so much for me.
Now, we've got a unit that parent can pick up the phone and call someone and go, help. This is what's happening and I need help instantly. And for those of us that have experienced things like that, it is a great thing to be able to pick up that phone and say, I need help and this is what's happening.
No longer do people have to go to those more intensive service delivery areas. We're helping to save people's lives. We're helping people to regain their livelihood and their quality of life. We are seeing very impressive outcomes with the services that we're delivering. We're helping people to get their lives back on track. If someone out there is a family member or a service provider and they know someone that is in crisis, they no longer have to deal with that on their own. There now is a service that's available, and we have experienced caring staff available to take your call and help you with your crisis.